Hello everyone and welcome. My name is Ashley from Mom's Meet and thank you for joining us today for the NeilMed webinar, which will be presented by CEO and founder of NeilMed, Dr. Mehta. If you have any questions during the webinar, please type them into the chat window. And with that said, Doctor, please take it away.
Good morning and good afternoon. Ashley, thank you very much for allowing me to participate in Mom's Meet's webinar program. And I thank entire audience to be available to join for this webinar. I would like to make it interactive to some extent, and our goal is to basically introduce about what NeilMed has done in the area of nasal and sinuses, particularly all natural way. So NeilMed was founded out of my medical office in year 2000 in Santa Rosa, California, which is an hour north of Golden Gate Bridge in San Francisco. And we are in a beautiful wine country. And originally when the company got started, I never thought that a small business vision that I had will turn into a multinational company, as NeilMed today spans from Asia to Australia to Europe to North America, South America, and some portions of Africa. So we are very happy that all physicians, all customers, and all the supporters of NeilMed have helped us grow. So Nina Mehta, who is president and co-founder, and myself started this in year 2000, January 2000, right after the new year. Our core values are persistence, so we take a positive, can-do attitude to get things done. Risk, always take a calculated risk, as in any business development, but at the same time, what is most important is the safety. Improve quality, customer care, innovation, and we started out only as one product, but today we have more than 30 products in the market all over the world. So we have continued to innovate as we got more and more comfortable in the area of nasal and sinus. We also spread out to infant and baby care, to first aid and the ear care. And some of the core values of the companies, this is for the organization. But what is most important for us as far as the product creation is safety. We want to make sure that the product is going to be very safe. That is followed by quality. So you make the safe product and quality. Now, if you can make a safe product and great quality, but if it is not effective, it won't help people, as all of us know. So third thing we look into is it is safety, quality, effectiveness. And that is followed by the affordability. Is the product affordable to masses, and is it available? So we use those principles by making a safe product, great quality, make sure the product is effective, make sure product is easy to use, and it is available and affordable. So using all those areas, we have made the company grow every year for last 16 years in a row. NeilMed has huge range of products. I'm not going to go into all the products, but our flagship product is NeilMed Sinus Rinse that you see almost in every store in America, and NeilMed NasaBulb. After starting nasal and sinus care product, we thought we should also branch out to other areas. So NeilMed started the ear products, where we have an ear wax removal system, and then we also branched out to the first aid by making a all sterile one wash saline. And most important is the infant and the baby care. And we started out with saline ampules and pediatric sinus rinse kit. But subsequently, we thought what is most important is the most effective way of suctioning baby's nose, because a clear nose and clean nose for the baby matters a whole lot more than adults, because babies need to be breathing well, feed well, sleep well. And those are very, very important things. So we focused and we ended up with NeilMed nasal suction devices. And most of our time we're going to spend talking about this particular device. So NeilMed's new product, we call it NeilMed Naspira Plus. Naspira Plus is same as our regular Naspira, which is shown right here, but it contains a saline ampules or vials, what we call Naspira Drops Mini, or we call Nasal Drops. And there are two names right now, but we are changing over to Naspira Drops. And the NeilMed NasaBulb. All of you have seen at some point a blue opaque or a green opaque bulb you cannot see. We changed this completely. Now all our bulbs are all silicone and they can be taken apart. And we've made of the material that you put it in the boiling water for sterilization. You can clean it and put in the microwave for a minute or two, and it will basically disinfect and sterilize the bulb. So we think that when you use a product for the baby, it should be safe, it should be quality, it should be effective, it should be easy to use, it should be affordable, available, but it also should be sterilizable, so it always offers the best safety for ongoing or continuing care of the baby. Now, all of us know that upper respiratory tract infection or URTI in childhood is very common, and most of the time it is a viral event. A child can get the bacterial infection, but viral infection is much more common. In this study, we want to show that about 500 children were studied or babies were studied who had persistent fever of more than 3 days, of about 100 degrees and more. Temperature may have gone up to 102 degrees Fahrenheit. And the cultures were checked in 83% of these 500 and 96% of babies out of patients whose cultures were checked had viral infection. The viral infection is #1 cause for infants and babies and toddlers and small kids getting upper respiratory tract infection. How do you deal with it? It's a very difficult situation when parents and caretakers have to take care of babies who are sick with respiratory tract infection because they do not sleep well, they cry, they cannot be fed well, and there is a difficulty in bottle feeding, breastfeeding, sleeping, breathing, and a lot of times they start wheezing. I'm sure some of you may have seen situations like this in your personal experiences. So what can we do as far as non-pharmacologic or non-drug management of rhinitis? Rhinitis is inflammation of the nose. So what can we do when our baby develops infection for the nose and in the nose and the sinuses? Now, traditional interventions have been that use antibiotics, and more westernized the country and more affording society, antibiotics may be prescribed compared to countries which cannot afford antibiotics and drugs and medical care very easily. But intervention with antibiotic is of course wrong in large number of cases where they've been prescribed for an unjustifiable cause because one could not do appropriate testing for the virus, and in that case antibiotics did get prescribed. The incidence of cold or viral upper respiratory tract infection is very common. Younger the child, more common it is. So for the age group 0 to 1, it is about 4, 2 to 3, it's about 3, 4 to 5, a little less than 3, age 6 to 10, about 2.2, and 11 to 20, about 2. So basically, it is just part of growing, a very common problem, very common situation, hard to escape. And duration of the illness may be about 7 to 10 days. and we all know it just takes time to get better from that particular illness. Now, during the infection, one sees a green mucus, and in the old days, we thought green mucus is bad, and it means there is a bacterial infection and antibiotic needed. But there is an enzyme in the white blood cells called myeloperoxidase. So during the infection, when the white cells reach the area of mucosa or lining of the nose and sinuses, the neutrophils are, or white blood cells are large in number, and when they break down, basically you will get the color of the mucus yellow-green. One can also see that in the springtime, that when there is too much of inflammation from allergies, one can have a green mucus at times. It's not very common, but it can happen. So every time one sees yellow or green mucus, it does not mean that it is a bacterial infection. What can we do for the prevention? Prevention is the key, and we can reduce the risk to some extent, as we know that almost all kids end up getting flu vaccine, and same thing is true for the general population, except people who do not want it or for one reason or the other reason. Accepted prevention, hand washing. Hand washing has been well accepted, and several studies have shown that hand washing is a great way to prevent other people catching from you, or after you have touched something, you wash your hands and you reduce the risk. But when you take care of a baby, it is just an impossible thing. It means how many times one is going to be doing that. So typically, you have no choice. Baby gets, mom gets, dad gets, and other siblings get it. A very common situation. Social isolation. Someone has a cold. It means basically you do not get close to that person. It's basically not an acceptable thing. Nobody likes it. Nobody should do it. It basically really humiliates the person. So probiotics. There are some studies that show that taking probiotics or giving probiotics to babies and infants and toddlers and kids and adults may help reduce. But there are not large studies. It has been shown only in small number of studies. So this still needs to be evaluated. Zinc. So zinc supplements have shown to reduce the burden of viral load, and one may consider not the zinc sprays. Zinc sprays do have adverse effect of the nasal and the sinus linings. In USA, no one is selling at present zinc sprays to my knowledge. At one time, there were products with the zinc sprays, but they are no longer available. But zinc in some form as a supplement may be of benefit. Garlic has been shown during the cold episode for whatever reason, either it increases the nasal and sinus secretions and flushes out, or it may have some sort of immunity, and it is very difficult to assess that, but it does help. And echinacea may help, and some of you may be using or may have tried. I do not have any personal experience, but some of my patients do use it. By the way, just for your information, I'm board certified in internal medicine, pulmonary medicine, and critical care medicine, and practiced in Santa Rosa from year 1987 until, actually I haven't quit, I just cut down the hospital practice. I still have my outpatient medical practice as a pulmonary physician. Saline. Saline in USA market was used for almost like maybe 7 or 8 decades, maybe even longer. Saline was used in United Kingdom even 150 years ago. I happen to have a textbook where they show using saline bag, flushing out the nose, and help reduce the mucus load in the nasal and sinus cavities and make the person feel better. So saline therapy, even though it has been there in USA and Canadian market for a long time, when NeilMed came in play and started doing lots of research for using saline for the nasal and sinus care, all the outcomes were so great that basically from few 100,000 units of saline used per year, it became not only for NeilMed but several other companies. Overall, saline used increased by probably 10 to 20-fold in a matter of last decade. So saline has been considered safe, effective, and as we all know, it is very affordable. So what was done to study the saline's effectiveness for the cold for children? Approximately 400 children were there. Symptoms were suggestive of common cold and flu, and saline irrigation was done using a pressurized canister where saline is sprayed. And out of 401, about 289 had saline irrigation, 101 had about standard medications, and 8 to 12-week follow-up was done. What was found? That saline users had reduced duration of illness and had less symptoms compared to standard medication like antihistamines and decongestants. And also reported disease-related school absences were less amongst saline. So how did saline help? Basically, it allowed nasal and sinus passage to stay clear, and that basically allow one's ciliary function to stay healthy or return back to normal as quickly as possible, and perhaps reduce the bacterial load and reduce the secondary infections. Now, treatment of the event is saline, nasal decongestants, and nasal decongestants, as you know, that Food and Drug Administration, that is FDA, and American Pediatric Academy, they recommend that under the age of 2 years, they recommend that saline is safe to use, but not to use antihistamines and decongestants, and that's the reason there are very few to none over-the-counter nasal decongestants available, which are recommended for infants, babies, toddlers, and small kids. So airway management. What is the airway management? We are not talking about managing the trachea and lungs. We're talking about nasal and sinus passages, but mainly the nasal passages. So suction of nasal secretions is advised by American Academy of Pediatrics and by FDA, and use of saline in combination with nasal suction is recommended or advised. And it is based on the scientific evidence. It is based on the safety and efficacy. Now, why bother with secretions in infants? Cough reflexes are not fully developed in some infants, especially in preemies, because they cannot cough. The secretions in the nasal passage are simply going to drain backwards, and ultimately some of that may get into trachea and create secondary involvement of trachea and lungs. So it is important to keep the secretions as little as possible, because babies may not be able to cough very effectively, and that's the reason to keep the nasal passages as clear as possible. Now, when you have a clear nasal passages, baby can breathe better, and that will allow bottle feeding or breastfeeding, whatever method is being used for the baby. It promotes sleep during upper respiratory tract infection exacerbation, because if the nasal passage is clear, baby will breathe better and likely to sleep better and do not get disturbed with recurrent coughing spells. So, to summarize, that nasal aspiration and use of saline is safe, it is simple, it is immediately effective, it is affordable, It's available by various devices available in the market. It immediately gives a sense of well breathing or better breathing for the baby, better sleeping, and better feeding. So due to all the above reasons, it is very important to focus on baby's nose during acute or upper respiratory tract infection. And as I discussed earlier, most of the time it is a viral infection. Now, what are some of the over-the-counter medications one may use or over-the-counter preparations one may use? Honey, a lot of people have tried using the honey. Antihistamines. Babies and small kids, I do not recommend that. Anti-cough or antitussive medication, again, not a great idea. Antihistamines, not a good idea. But if babies are having difficulty in breathing or wheezing, or kids are having that, according to the pediatricians or a doctor's recommendations, one may give bronchodilator, treatment in some form. And basically, one can try, but it's just going to require time, one's own immunity to take care of the infection and get better. Honey has been tried, and basically dextromethorphan and honey, or honey alone, or no treatment. So basically, the treatment with honey and dextromethorphan has been of some value, and one may consider using it. Now let's talk about what NeilMed has for children. We have, like, NeilMed's product called NeilMed Sinus Rinse for Kids. It is the squeeze bottle that you have seen in all the stores all the time, and it comes with a black cap. But this product is mainly available through us in some select chains only. It is not available throughout the country, because most kids, by the time they are ready to irrigate, they are using adult kits only, and they are not going for the pediatric kit. So pediatric irrigation, can children take irrigation? Are they going to accept it? Are they going to run away? There are lots of YouTube videos available where small kids are doing saline nasal irrigation with a lot of pleasure, happiness, showing off, and it's basically our loyal customers have posted them. You can just simply put like NeilMed Sinus Rinse on the YouTube and you will find them. What study found that about 860 surveys were done for pediatricians, and 75% of the doctors or medical caretakers talk to patients or or parents about the saline nasal irrigation, and 61% felt that parents were responsive to the benefits of nasal saline. So if nasal saline was used or recommended, that some parents were accepting. It was not a broad acceptance or overwhelming acceptance. And saline was offered by physicians to patients or parents. So physicians were female, less than 50 years, so younger physicians were able to recommend saline more compared to physicians who were in the higher than 50 age group. So in conclusion, prevention method, physical, will be like hand washing, mask, zinc, garlic, saline. Treatment option, decongestants, suction, and saline. And managing expectations of parents is most important. Frequency of event can be explained. Expected duration should be informed. How many days of mucus production will continue, and discuss about nasal secretions, discharge, etc. And basically, a good communication with parents is very important, because when a baby gets sick, it really basically freaks everybody out and everybody starts worrying and what is going on. And some of us have seen little kids after the upper respiratory viral infection end up getting infection in the lung. Now, I want to show you a little bit feature of the Sinus Starter Kit. Same features do apply for the adult kit that you all have seen or probably seen. So large volume is the key. Why large volume? You want to flush out the nasal passage with a large volume. Just spraying little saline is good. But when you use a large volume, it basically clears it out mucus in one sweep. In low pressure, you should not put too much pressure or one may feel pain in the ears. And buffered saline is very important because buffered with sodium bicarbonate, it prevents any burning or stinging sensation. Saline is drug-free, as we talked earlier. It's an excellent way to clean mucus from the nose and making medications more effective. So a lot of people use corticosteroid nasal sprays, or some people also use decongestant sprays at times. If you apply the spray when you have nasal lining coated with mucus, it's going to be effective but not as effective. But if you wash it out first, wait for 5 to 15 minutes, and then apply the medication, it is likely to work better. And this study was researched at University of South Carolina Medical Center, and it shows that when you use two together, outcome is a whole lot better. What does saline do? When you put the large volume, it will clean out the allergens, irritants, bacteria, viruses from the nose and reducing the frequency of infection. Because when you wash out and keep the nose clean, the nasal lining returns back to normal function, gets more healthy, and makes its own defenses and may help reduce the sickness. I'm not claiming that it will definitely do it, but hundreds and hundreds of anecdotal reports show that. And let's talk about the Naspira. The Naspira is the most unique device. I think it is best of its kind in the whole world, that this is the best device created for nasal and nasal suctioning of little baby's nose. Why is it so unique? Either one can get a regular bulb or one can get a suction device. What I've created here is we have the bulb, as you can see here. There's a flap or a closure, green piece right here that we can close it and use it as a regular bulb, just like you see it here. But if you want to use the nasal oral suction, one has the option in the same box where you have this orange piece. I will explain to you in detail in one more minute, the tubing and the filter. So basically what Naspira does, it allows like two choices in one package. You can use it as a standard bulb or you can use it as a nasal oral aspirator bulb. And I will tell you why nasal oral aspirator is very important and why one should consider using that when needed in lieu of just a standard bulb. So first of all, the device is sterilizable. You can wash it with soap and water and put the whole thing in boiling water for 5 minutes, except the blue filter that you see. The blue filter has a paper filter, so it will basically disintegrate, but filters are supplied with the unit. So you use basically the Naspira, all the components, take them apart and put in the boiling water. It allows, why nasal oral aspiration is important. When you have the bulb, and if any of you have a bulb at home, and if you were to time, basically after you squeeze it and let it go, it takes only half a second or less time. So the suction duration is very, very little. Imagine you have vacuum cleaner, that you turn it on for half a second, it's not going to suction anything, it's basically going to do nothing. The same thing happens to bulb many a times, and it is very frustrating for child and parents that suctioning doesn't take place. So by having suction duration of 3 to 4 seconds, it really helps you. It is not invasive. There's an inline changeable filter. It reduces the contamination risk. By having the filter, there is no risk of contamination to the parent. The tubing is thick, it is kink-free, so you're not going to have any problem as you start suctioning. And it is BPA, latex, phthalates, and lead-free. And basically, nasal oral aspiration has become popular more in last decade than in last century. But it is not entirely a new concept. People have used this device for a long time. What I'm going to show you here in this graph, that when you do the nasal oral suction, and if one can take a slow breath, one can have the suction go for almost like a 20 seconds. It's like taking a very small, slow breath, and you can have the flow as high as 16 liters per minute. So for effective suctioning, you need that. If one were to use the bulb, the flow goes up and it comes down so fast. So the flow may go up, but the duration is the limiting factor. So it's very important to have suction flow higher than 5 to 10 liters per minute and duration more than 3 seconds. It's going to allow you to effectively suction out. Now, we don't want to use your entire force into suctioning baby's nose out. You have to do it gently and get the feel for it. So it may take 1 or 2 efforts. In our research of several thousand doctors and customers, we find that within 1 to 2 attempts, 90% have achieved the goal of an effective suctioning. So that has been our research. This slide just shows that inline filters are available. It's a very easy way to replace them, and some of you may have already seen. And how do you give the saline, and what is the best way to give saline before suctioning? So what we have found that suctioning is much easier if you have primed the nasal cavity with saline. So what is to be done is you take the saline ampule that is shown here, right here, and you twist the tab off, and this becomes 1 ml sterile, ready-to-use saline. You can instill few drops into the baby's nose and follow by the suctioning. You don't have to use the Naspira. You can use any bulb syringe that you may have. If any of you have any opaque bulb syringe, I would really urge and report back to us. If you can cut it open, you are likely to find black mold, almost like I can guarantee close to 95 to 100% if you have used it for a period of about 2 to 3 weeks. Or at 1 month, definitely you're going to find that. I have found it almost 100% of the time. Okay, so again, to summarize, that Naspira Plus or Naspira without saline ampule plus, only difference, as I mentioned, is that there is a saline ampule available. So sterilizable, flow can be 10 liters or more, allows for 3 seconds of continuous suctioning. It is not invasive. There's an inline changeable filter. It's a clear see-through 2-in-1 design. You want to see what is inside. Here you can see everything. Reduce the contamination risk because you can sterilize it. Kink-free tubing, BPA, latex, phthalates, and lead-free, and 8 saline vials are available in this particular box. These are the saline. So new name, sorry I showed you the Nasal Drops Mini because we have a 15 ml large vial. We call it Nasal Drops. And we changed the name for babies' ampules to Naspira Drops. This is going to be available at only Walgreens starting July, while Naspira is available in all stores, as I showed earlier, at Walmart, at Walgreens, at Rite Aid, Toys R Us, and Babies R Us, about 500 stores, and Target only in the children's cough and cold. So it's not available in the baby areas all the time. You may have to go into children's cough and cold in Target and in the Walgreens and Walmart. Going further, NasaBulb. What is a NasaBulb? NasaBulb is basically a blue bulb is no longer used. The green bulb is all silicone, all see-through, same features as Naspira, except suctioning is for a short time. Some parents may not prefer to do nasal oral suctioning. Caretakers, or babysitters may not want to do it, so this is an option available. But the beauty is you can see through. It's a very nice, soft silicone tip, and people love it. I'm sure you can see the reviews on the Amazon.com for any of our products. Now, what is a PediaMist saline spray? That is a drug-free, no drugs, no decongestants, nothing. Isotonic sterile saline spray. It is buffered with sodium bicarbonate, creating a non-burning, non-stinging mist to soothe and moisturize dry nasal passages. Or if passages are already moist with thick mucus, you can still use some saline spray and soften up the mucus. It's a natural relief of stuffy, congested, and dry noses. It helps loosen mucus secretions to aid in aspiration and removal from the nose. A specially designed tip for infants and children. Its convenient spray operates in any position, but we prefer that when you use saline drops, you can keep the baby flat on the diaper table or in the bed and put 1 or 2 drops. That's okay. But if you need to be spraying or put a larger volume, we prefer that you hold baby upright, so not a whole lot of secretions will go in back of the throat and make baby feel uncomfortable. We have a NeilMed Baby page on the Facebook. You can find us there. Look for NeilMed Baby, and you can see, what is happening. And I would like to show you this video. So please.
Hello everybody, today I'm going to be sharing with you a very unique and innovative child and baby product. This is the NeilMed Naspira, and this is made by Dr. Mehta. The Naspira is basically a nasal oral aspirator. Now this is perfect if you have a sick baby or a sick child and they have a lot of mucus and they're having difficulty breathing. The Naspira comes in handy because you can help them to get rid of that mucus so that they can breathe easier and feel better. The cool thing about the Naspira is that it's actually a 2-in-1. The first way you can use it is actually by placing the tip in your child's nose and then using the hose and the mouth portion here to use your air force to help suck that mucus out. The second option is to detach the hose like so, and then you can place the cap on the bottom and you can use it as a regular nasal bulb. I absolutely love that this is a 2-in-1 because sometimes all you need is the power of this nasal bulb here to help get those little boogers that might be just inside their nose or hanging outside their nose, and this is all you need. But sometimes there's a lot of mucus and might be a little bit more stuck and you might need more force. So that's when you can come in with the power of this and use your air force to help suck that out for them. If you like to use it that way, all you have to do is replace the hose right here, and then you're going to suck from the orange end. Now, the great thing about the Naspira is that there's a one-way valve, so this means you don't have to worry about your air going back into baby. The other awesome thing is that there is a disposable filter right here, so this really reduces the risk of contamination. I'm quickly going to show you right now how I use it on my baby, and then I will tell you a little bit more about how to clean it and about the different parts. Alright, so to use the Naspira, you just want to have the baby sitting upright in your arms so that they're comfortable. We're going to insert this part of the nozzle into her nose while placing the orange part in your mouth. And that's where you're going to suck from while the tip part is in her nose. You just place it in her nose and suck just like that. And then it will come right down here into the bulb. Now, if you don't want to suck yourself, you can actually remove this portion here and place on the cap. And then you can just use it as your typical bulb syringe. So you're going to press it before placing it in baby's nose. Whoa! And then release once it's in her nose. Just like that. So as you can see, it was really easy to use. My baby didn't mind it at all. I was able to suck gently enough that it didn't alarm her, and she kind of thinks it's a toy. One other quick thing I wanted to mention, if you find that the mucus in your child's nose is a little bit thick and it's having a little bit of difficulty coming out, you can think about using a saline mist to loosen that up prior to using the Naspira. A really great one by NeilMed is called the PediaMist. Now this is for children that are 1 year and over, but this is amazing because you can just put a few couple of quick squirts in their nose and it will really loosen that up. Now, the Naspira is made of high-grade, very soft silicone. It's also BPA, latex, and phthalate-free. Now, the Naspira is dishwasher safe, and the components are really easy to remove. All you're going to do is push on the tip here, and then push on the bulb, and that will enable these two pieces to come apart like so. Next, you're just going to detach the hose from the bulb. Those come apart like that. Then there's the disposable filter, which can be pulled apart from the hose. Now, the pack does come with extra disposable filters, and you're going to want to replace them so often and as your baby gets sick. Then there's the hose itself, and then at the bottom there's the orange part that you can suck on, and that's also detachable, just like so. The only portion of the Naspira that is not dishwasher safe is the disposable filter, and that's this portion right here. However, this piece is key because this is what prevents the mucus from entering the parent's mouth. I know that's a big concern of many parents when they see someone sucking from a tube straight from their baby's nose, but no, there's no risk of the mucus entering your mouth. The Naspira can also be sterilized. There are 3 different ways that you can do that, and the packaging here comes with instructions on how to do that. This is what the packaging looks like here. But basically, the 3 ways are that you can use boiling water, you can use the microwave, or you can use certain disinfectant solutions. This is what the packaging looks like here. It comes with a 2-in-1 nasal oral aspirator. It comes with 7 disposable filters, and as well as a green carrying netted bag. Funny enough about it on the NeilMed Naspira, I love this thing. I think this is essential for any parent. I love that there's the added bonus that you can use just the nasal bulb on its own, or if you're having difficulty expelling that mucus with just the bulb, you can attach the hose and use the air force from yourself as well. Like I said, it's very easy to use, very easy to clean, and it's made of very high quality material. So I definitely recommend this. Thank you so much for watching.
Okay, now we showed you the product. Thank you for listening. NeilMed, in addition, is also doing Baby Nasal Care Charity Project. Our pledge is to give 300,000 units of pediatric products for low income in medical clinics. Our focus is children age 3 and under. And we have started this program by writing to 1,000 clinics in the state of California, and will be expanding nationwide soon. And if any of the participants are aware that there may be some need, we'll be happy to help get the project going. Now, I want to make one announcement that we do have several hundred people who have joined this meeting. Since you all have spent time and you all are interested in what NeilMed does, what NeilMed is going to do is, if any of you go out and buy 2 products of NeilMed, we'll give you 100% free. You have to, we'll put a page today on our website. So basically you can go to either Walgreens, Target, Babies R Us, Toys R Us, Rite Aid, Walmart, and can get baby saline spray or Naspira or 2 Naspira or 2 NasaBulb. We would like to offer this, and if you need further questions, just simply write to questions@neilmed.com. There is questions, questions, plural, at NeilMed, NeilMed.com. And if any questions, you can always call us at 707-525-3784. That is 707-525-3784. So you can visit the local stores and feel free to buy. You will get 100% money back refund to your buy check. Thank you so much, and I'm ready for any questions. Or Ashley, you can now take it over and lead the meeting.
Okay, thank you so much, Doctor. We have a lot of questions come in. We obviously can't get to everyone today, but I'm going to take some of the most popular ones. One from Martha is, how young of a baby can use a Naspira? Can it be used on a newborn?
You have to, newborn, of course, will have pediatricians in attention like right away. It can be used just if baby has mucus or baby has watery secretions, you can certainly use. Just use it very gently, because as you know, all the hospitals provide the bulb syringe for suctioning baby's nose. So there is absolutely no problem. Just be gentle.
Okay. Dallas would like to know if you should use 1 Naspira per child.
Dallas, I think it should be one Naspira per child because otherwise you will have to, clean it, boil it, disinfect it. As you know, in hospital, we do use a lot of surgical tools by sterilizing on different patients. It is okay to use, but it is not very practical to, keep sterilizing in between the uses.
Okay, great. Pam would like to know exactly how long would you recommend a Naspira unit is good for before replacing it?
I think the way we have designed, there is no need to replace it if you take care of it by disinfecting periodically, like in boiling water, like after cleaning with soap and water, or disinfecting in the microwave after it has been cleaned with soap and water and it has dried out. Our products are guaranteed for lifetime, so if anything goes wrong, simply write to us at questions@neilmed.com and we'll replace it for free.
Okay, great. Kirsten would like to know, what is the maximum age you recommend for a toddler for the Naspira?
I think there is no age limit. If your child has difficulty in blowing the nose, you can use it up to any age. So even if they are 3, 4, and 5 years old, we do get comments from parents using it, that age group. And if child can hold still, I will put either saline spray and then suction it out and see what kind of benefit the child gets. But by that age, 4 to 5, you may want to consider using large volume saline irrigation using like NeilMed Sinus Rinse Kit or pediatric kit.
Okay, great. Again, we had a lot of questions today. We couldn't get to everything, but as Dr. Mehta had said, send in any questions you have to questions@neilmed.com. We just want to thank everyone who participated today and to all of our mom ambassadors who are sampling NeilMed products. We look forward to hearing all your feedback. We're going to go ahead and log off now. Just a reminder, the winners of today's webinar will be contacted privately over the course of the next week, and also the coins that you receive for joining the webinar will be issued within the next 2 weeks. Have a great day, everyone, and thank you, Dr. Mehta, for joining us today.
Thanks to everybody. Thank you very much. Bye.